And Henry Ford Jackson Hospital infectious disease specialist, Dr. Vivek. Good morning.
Good morning.
Morning.
Well, we are seeing it again. Numbers are starting to uptick. What does that mean?
Well, as we open up, there's definitely going to be more spread of the virus. The good thing is most of the spread is among individuals who are reasonably healthy. So the younger ones, especially the ones who go to school, or parents whose kids go to school, play sports, and majority of the time the disease is fairly mild. Mm-hmm. So that's somewhat good and encouraging. We aren't seeing too many inpatient admissions going up. So all of that is encouraging in the sense that the virus, I think, is going to be with us for some time, kind of like the flu. And as long as there is under vaccination across the world, we're going to see new variants. And as long as there are flights and cruise ships and travel, we're going to see those variants come here. So we just have to learn to live with it in some way, shape or form.
Yeah, I have a few viewer questions today. Now seems like a good time for the first one. Now that hospitalizations are down and the risk of severe illness from COVID seems under control, would you recommend that I still get my 5 and 7 year olds vaccinated?
Yeah, I mean, I think it's an individual decision in some ways, but the advantage of the vaccination is that it decreases mild disease to even milder, especially in people who have been vaccinated. So the younger ones, if you can get them vaccinated, definitely would be a good idea, even though the data isn't great in terms of preventing acquisition of the disease or transmission. There is some decrease in transmission. So if those kids are going to be visiting their great-grandparents or grandparents who may have not been vaccinated or have underlying chronic medical problems, it's a good idea.
Yeah, it's still the protection for others, which I think
Exactly.
We haven't thought about in a long time. And I think in Michigan, when summer hits, I mean, this will be the third summer, right? Everyone just kind of forgets about it, which, the weather, I think, does help the disease, but it's still going on a little bit, huh?
Yeah, I mean, I think COVID has been an epidemic of different intensities among different populations. Kind of people who are reasonably healthy, younger, haven't had significant disease. While if you were in a nursing home or if you were elderly, especially if you were above 80, it's a completely different disease. I mean, as you discussed earlier, we've hit 1 million deaths, and that should be a sobering number. The trouble tends to be we see younger individuals who say, oh, I had COVID twice, I didn't get to any significant degree of illness, which is completely different from if your parents or grandparents were in a nursing home. I think there the disease basically ran rampant, and a lot of individuals lost significant years of their life. I mean, the older you are, the more sick you're going to get, and you're more apt to kind of die from the disease. So that is a completely different disease in that population versus if you're in your 20s and reasonably healthy.
Yeah, and we're all kind of reacting based on how our own personal situation has been in the last 3 years. If you've been around people that have struggled and been ill, you're more in tune with it. If you haven't, you don't take it as seriously, and I think that's just kind of the way we go.
Yeah, exactly. I mean, I think that's the trouble with the living in tribes. Kind of, you're all in your tribe hasn't been affected with the virus, so you tend to blow it off a little bit.
Yeah, this week Jackson County Health Department reporting that since the pandemic began, now 40,000 Jackson County residents have been diagnosed with COVID, and that number we expect is low.
Yeah, I mean, I think lately, especially, a lot of individuals have been doing self-testing, so those don't often get reflected in the stats. So there's definitely more disease than we kind of have official numbers for. And the same thing with deaths. There's probably been more deaths either from COVID or from missing healthcare because of COVID and all the other stuff. There's been an uptick in patients, at least in the initial part of the epidemic, who missed healthcare because they were just worried about going to the hospital. I mean, we still have individuals who refuse to go to the hospitals because they're worried that they'll get COVID there, and kind of not only will they get COVID there, then nobody will be allowed to visit them. So they only show up at the ER until it's fairly late in the game.
We did have a 1-2 hour period 2 weeks ago that the hospital had no COVID, but it lasted just 2 hours.
Exactly. I mean, I think I get a list of everybody who's been tested positive, and I think 4 weeks ago there was a day when there were 3, and I was kind of hoping that that's it. And yesterday they were in the, I think 33, and today they're nearly 15 or 16. So
That's.
I don't think it's going to go away that easily.
I'm going to shift gears a little bit. I have another viewer question that I gave you a little bit of a hint on, and this is good because you and I both have weaker stomachs. Is it possible to? I've heard it's you're more likely to get food poisoning in the summer months than you are in the colder months.
Yeah, I mean, I think backtracking. So bacteria like an optimum temperature. That's why 37, 38 degrees centigrade. So that's where they multiply the most.
Okay.
So in cold, in freezers, they don't multiply. Second, when you're out and about, you're going to have the dips. So the dips, the yogurt, that's the thing that you've got to avoid.
Yeah, especially at those family picnics where you don't know how long it's been sitting out, right?
Not only that, so that's one thing. A, it's been sitting out. Second, most kids go there, and I don't know about your kids, but when my kids were young, hand washing wasn't a very high priority for them.
No, if my kid uses, does any chip and dip, there's sauce all over the knuckles. I have friends like that too that are in their late 40s that do that, but I don't think I'm going to be having any dips this summer.
No, and I think George Costanza, was probably the worst violator of the double dipping.
He did that and ate out of the trash can, which
He did.
that's not a good idea either.
No.
Typically not. I think wouldn't recommend it.
So all these other things we've had kind of, on the back burner, all the other public health issues. We're seeing, increases in sexually transmitted disease. It's going to be mosquito season again. We're going to have mosquito-borne illnesses. There's a lot of other things to worry about.
Yeah, I mean, I think we are surrounded by pathogens that like to feed on us. And as we start going up and about around, they'll start working their stuff with us. So mosquito-borne illnesses, especially, this has been a reasonably wet spring, so we are going to see an uptick on all mosquito-borne illnesses. We'll probably see an uptick, I suspect, in West Nile this year, especially since the last couple of years we didn't have a lot of disease. Flu is definitely still in the community and it's going up. So all of these other infections, foodborne illnesses, are definitely going to go up. And sexually transmitted infections have been on an uptick for some years, and with people staying within their houses and now starting to go about, we'll probably see an uptick in that too. But the good thing is most of these illnesses can be diagnosed, and if they are infections, a lot of them can be treated. The key is getting them diagnosed and seeing someone quickly.
All this Clorox and Lysol and Purell that we've been using over these last 2 years, are we making viruses and dangerous bacteria more hardy?
Well, there is data, less so with pure alcohol, kind of, because that tends to kill off everything else. But with some of the antibacterial soaps, that we were increasing the resistance to some of those pathogens, to those chemicals. But hand washing, I still think, is probably the most effective tool we have in terms of preventing infections, kind of. So I wouldn't stop hand washing.
No, I will not do that. I will not stop hand
I won't
washing.
stop doing that either.
Okay.
No.
We have a policy in our building too, with instructions in every bathroom, which I think everyone should.
Yeah. And I love the signs in the restaurants. Employees must wash hands after using the bathroom before returning to work. I think the sign should say, everyone should wash their hands after using the bathroom and returning to the restaurant.
Yeah, probably so.
Not just the employees.
Probably a good
I think
idea.
it gives us false. So, well,
I've looked
I
at
don't
that
work
sign
here.
and walked right out with
I don't work
washing
here.
my
I don't have to wash my hands. So,
Not true.
all right. Any big Mother's Day plans?
Not yet.
Same.
Thanks for coming in today.
Thank you.
Dr. Vivek, infectious disease specialist at the PIIC Center. Stay tuned. Coming up next, Butch Irwin